With me, I have colleagues, the interns, both doctors and nurses, and midwives at the headquarters. Why we are here, we want to give a brief statement on the internship placement. Ministry of Health in August 2024 wrote a letter asking for the interns to apply, whoever qualified. And it was open letter. It was an open letter. They did not specify which years, so long as you have finished and you are supposed to do an internship. Now, the challenge came in when these interns started applying. They applied, they went to the different councils, they paid their money, and they were given license, temporary license for practice. Now, the other challenge which I have here, which the government should know, is that the same interns, they were subjected to an induction by Ministry of Health. All of them, those who applied. First of all, remember, these people went to pay, and they are granted permission from their councils. And now here, you have called them, come for induction. If you are called for induction, it means that you have been accepted to do the internship, because they are going to tell you exactly what you are going to do in various facilities. And remember, the council issue only the certificate which expires 1 year. So upon paying your money, they give you a license of 1 year. Now, the government, through the Ministry of Health, had their budget of 35 billion shillings to cater for 2,286 internees, including SHOs. Now, out of that budget, I think it was underestimated, because the interns which were supposed to be there is 2,706, the total number. Now, what is our concern here as professionals? First of all, the letter was open. It did not specify that how many the ministry wants, from which year to which year. And another letter comes from the ministry saying that we are only taking 2023, those who qualified 2023. And before. And before. Meaning that 2021, 2022, and 2023. Now, those who qualified 2024 were inducted and were given licenses. So where are we taking this group? Because they have paid already their money and their licenses are going to be expired. So our concern to the government, and particularly Ministry of Health and the Parliament of this country, that this balance of 2024, where are they going? Because their licenses are going to be expired. Number two, our concern is that there was a letter that the Ministry of Health issued in August still, and says that the priority of considering the interns of 2024 went to tendo surgeons and pharmacists who work in government. Yes. Let me tell you this. when we are in school, all of us, regardless of who sponsored who. But again, it is painful for the parent to sponsor the child. This one of government was even not a priority. The person who has spent money over 20 million shillings on a student should get the priority to go for internship. Now you are leaving them out and you say, because this was under government scholarship. No. When you have inducted me, when you have called me, you have licensed me for 1 year, and you leave me out because you have government students. It doesn't work like that. Then you should have said this term or this routine this year is for government only. Then another schedule is for private. Because the peasant there suffer a lot to pay a lot of money at the medical school. We pay a lot of money in medical schools. That's why we are very bitter about it as my son to be out of the bracket when you have given us opportunity to apply. So it was not correct. And this thing should be corrected because it should not just becoming as a discrimination in the nation. There's nothing that we can we should embrace of the discrimination in this country. We are all equal and all students went to school, and we need justice for everybody. This is injustice by saying that the priority went to, because 2024 there are also nurses who are private, doctors who are private, but they have given them licenses and they were supposed to go into internship. I understand that the deadline is today, and now here we are. So against that background, we are calling upon government to consider the 1,111 interns to go for internship. Because even the government, when through Ministry of Health realized that the money, so the 5 billion was not enough, they requested Parliament another addition of 18 billion 813 600. So that this money could gather for 1,111 of those who have remained behind. So we call upon Parliament again, because Parliament, this thing was discussed in Parliament. We call upon the Prime Minister to act for this additional money so that we don't have issues with our young professionals. These are young people, they need to come up and replace us. So we need to give them priority. You remember in Youth Day, what the president said, consider young men. Consider young men to go and do some good thing for this country. So we welcome these young men on board so that they replace us tomorrow and they could be good citizens of this republic. Otherwise, we are petitioning Parliament. Tomorrow, on Monday, we are going to send our letters to Parliament, more especially the Deputy Speaker of Parliament. We want him to hear us this, because he was chairing the session at that time when the issue of interns was handled. Otherwise, we want the answers from the Parliament, from Ministry of Health, about the 1,111 interns to go for internship. And we need them to be given money as soon as possible. Let government find out all ways to make sure these young youth go back. Otherwise, we are not happy as a profession. Both medical profession, nurses profession, midwives profession, we are all grieved. At least the government should come up with stand on this. Otherwise, we shall be back on the press on Friday. If we don't hear anything, we see again what we can say somewhere else. Who qualified in 2023? Those ones I'm referring you to Nurses Council. Because Nurses Council, we consulted them and they said if there is any nurse left on 2023, we forward the names to the Nurses Council, which we agreed with the registrar. So right now, I want you to move to the Nurses Council and you said this, we qualified 2023 and we were not deployed. So that one, your case will be solved as soon as possible. So you are not among these. We are subtracting the three of you, but now we want the 109, which is still out. Thank you very much for God and my country to love and serve. Action. I may not say it now until our letter is replied. We are writing a letter to the Deputy Speaker on this matter. And if the government could hurry and handle it tomorrow on Monday in the cabinet, then we shall raise our case. But if there is no outcome on Monday from the cabinet, then we are also seeking audience by Parliament, and then as I told you, by Friday, we should get a way forward, and we raise our case by Friday. So I will call you here to tell you my course of action. The next, I will be hearing from cabinet maybe Monday, and on Tuesday, Wednesday, Thursday, between the 3 days, I would have heard from Parliament. Then Friday, I call you here. Then we tell you whether things are good or they are going in another direction. And two, this 2023, you see why we are concerned on 2024 is that they should have stopped everyone 2023. But because the letter was also open, the 2024 people applied. Then another scenario which happens here in these letters of the Ministry of Health, that they awarded the 2024, some cohort, some few, to go for internship because they were sponsored by government. So that's why we are saying that no, we should not allow such a scenario to happen. When you close that 2024, whether you are sponsored by government or you are private, you limit yourselves in 2023. But if you sneak some few from 2024, what about others now? They will complain, and that's their cry, that why the ministry considered this sponsored student than us who paid from our pockets, from our parents, money, and we qualified together. Thank you.
One, it is inconceivable that the parent ministry, Ministry of Health, the home for health workers, is not putting enough effort to support this drive. Two, it's not to moralize the students, parents, and even students, parents, and institutions which are training these professionals. It is a practical requirement that after qualifying from that classroom training, you must undergo internship, supervised internship. But also I want to share with you that it is not correct for the ministry to argue that they don't have enough specialists to supervise these internees. The internees of nurse and midwives are supervised by senior nursing officer, graduate nursing officer, and the principal. Those professionals are there on the ground. So it is not correct for them to say that they are not taking on enough internees because they don't have specialists. The interaction percentage of internees with specialists is minimal. Therefore, that one we don't buy it. The Ministry of Public Service issued an overarching circular standing instruction, which argues that all the people who qualify from training institutions must undergo internship, and the guidelines are very clear, and they are there. It is also objective number 8 of the Uganda Constitution stipulates that resources must be well distributed among the sectors. This sector of health is one of the sectors which is supposed to get part of the national resources. Objective 8 of the Constitution. So are they now abating that objective? Furthermore, it is going to weaken the profession. Now we are creating another kind of standard. These are professionals who underwent internship. These are professionals who did undergo what? That one is, we can't buy it as a union, and we shall not support that. So these people should come on board and be. And then, very important, when you are issuing a policy, you don't wake up and say, I'm stopping to fund this. You bring it through the regular, the policy evolution process. Starting from the affected, going to the sector, going to the parliamentary sector subcommittee, and then being brought to the plenary. So it is not conceivable that one minister can wake up and say, we are not able to do this because it is a policy already in place. You need to know, lastly, that these interns constitute almost 60% of the workforce in facilities. So if they are not being enrolled, being subject to internship, who is going to support the health sector? That means that we are subjecting the health of the public to a risk which is not good.
The solution, we know the solution. The minister came out the other day and said all they need is a supplementary of about 18.7 billion shillings so that all the interns can be deployed and we completely get rid of this backlog issue, which will become a recurrent issue if we don't take care of it now. We did some statistics and we found out that final year students right now in the universities, about 2,700. Now, if we do not go right now, the number next year will be about 3,800, almost 4,000. But what are we saying to the government right now? If they feel the burden of the allowances is too big, we are saying internship only lasts 1 year. And what we can advise them to do is to waive taxes of this internship money so that it can cater for more people. A directive came from the president in 2021 that interns were to be paid 2.5 million. That only happened under one cohort, and then it was sliced to 1 million. But even then, the other day the minister was saying that for one intern, they were budgeting for them 1.3, with 300,000 going as taxes. Now, if the taxes was waived, more money will be available for more interns. And we're advising the people in the finance department or the finance ministry to look into that. And actually, it's government that stands to benefit from all this. Because the faster the interns are rolled out, the faster they get into formal employment. And if those don't get into formal employment, they will start up clinics. The other day, we were celebrating the Youth Day, and we've been talking about the unemployment issue that's gripping this nation. If the interns are done with their internship, they'll get the licenses, and some of them will start up clinics. These will be sources of employment to other workers, including these other people. And on top of that, still the government will get taxes out of this. So actually the government stands to benefit from a timely deployment of all interns. And we beseech the cabinet and parliament to seriously consider giving a supplementary of 18.7 billion so that all interns can be deployed immediately.
Olwaleero tuli wano 16th of August, tuli ku ekitebe kyaffe ekikulu e Mulago ku headquarters ne ba interns nga twogera ku kyabaddewo ewiiki eno ne wiiki eri endala eyaggwawo ku bintu by'okuteeka okuweereza ba interns ebifo ebyokukola ki ebyokukoleramu practicals basobole okubeera prepared okufuluma basobole okuba nga bakola. Twagenze okulaba nga gavumenti teyagendedde bye bakoze tetwabyagadde bulungi ffe nga Uganda Nurses and Midwives Union, kubanga balesewo abasawo abamu ne babaleka emabega ate nga bamaze okusasula okuba nga bakola ki bafuna license za kukola internship. Kino kyabaawo mwezi gw'omusanvu nga ministry efulumiza list ate ebbaluwa gye basooka okufulumya nga bafulumiza ne babuulira ba intern bonna nti no bajje basobole okukola internship. Ebbaluwa yali eri open yayiteraga nti oba emyaka einaku babaagala abantu b'emyaka kuva ku myaka abaqualifyinga mu 2021, 2022 ne 2023 yali eri open. So abasawo wano bonna ne bavaayo ne bawandiika nga basaba okulaba nti bakola internship. Kati ekyaliwo zino billions 35 n'okusubamu Ministry of Health yatulaga nti bajja zikosa ku basawo 2,286 nga bano balimu n'abasawo abadokita n'abazaalisa n'abanaasi. Kati sente zino bamaze ne bagamba tezigenda kumala, beetaagayo 18 billion. So fenga Uganda Nurses and Midwives Union tugamba nti okukola internship kintu kya mugaso nnyo. So twandibadde tusaba government zino billion 18 Ministry of Health zeyagala baziweeyo kubanga bano bafunire Ministry of Health sente zino kubanga bano abasigadde emabega bebataweereza bifo abenkana abazaalisa n'abanasi n'abadoctors abenkana enamba 1,000. Kirabika nti si basanyufu era sawa za leero baagala demonstratinga batambule balage engeri gye balumirwamu. Ate ffe ng'abasawo tusaba nti siina kusooka ng'omanyi amateeka kye googera, siina kusooka ne demonstratinga ndeetera abazadde bange okubanga bawulira bubi bano abasasula fees. Gavumenti eryoka eveeyo. Tusaba gavumenti eweereze zino essente ezigenda okukolerwako bano bonna abayewandiikisizza basobole okugenda basome bamalirize kubanga internship ya mugaso nnyo gye muli eyo oba oli mu palamenti oba oli wonna wooli ono intern bw'aba tasobodde okukola koose eno esembayo kino koose eno ekolwa omwaka gumu bw'aba tagukoze kiba kitegeeza tebamupreparinze bulungi tebamutegese bulungi okulaba nti asobola bakolako. So kati tusaba gavumenti etuyambe zine sente zisobole okulabikwa basobole ozisasula zisobole okuyambako Ministry of Health okutwala eno enamba kubanga eno enamba already tetumanyi lwaki baayita abaana bano ne babakola induction ne babagamba nti kati muli ready ne baba preparing nti balina okugenda ate ne bamala ne basala enamba ne bakola 1,500. Kati wenjogera 1,500 bali ready bawadde ne deadline kutandika leero naye ate batandika leero ng'ate n'abalala bakoze eki bakyaliyo. So twandibazidde tusaba Minister tukusaba yanguwa olabe nti mu cabinet opresentinga zine sente bazikufunire government ezikufunire kubanga tetulaba lwaki oyanguwa nnyo okusindika eno list eno group egende ate ng'omanyi nti waliwo abalala bakyali grieved. Bano nabo bantu twalabye waliwo list gye wafulumiza wasooka n'otunyonyola n'otugamba nti oyagala kulekayo aba 2024 awo nga Ministry of Health noddamu 2 days ago ku UBC twawulira ng'ogamba nti ogenda kutwala abantu mu 2024 wapikinzemu honorary pharmacists abali sponsored by government ne dental surgeons. Ekyo tukitwala toli mu kukola bwenkana ffe ng'abanansi tulowooza nti tewakozeseza bwenkana wandibadde still ng'ogenda mu 2024 sente no bwe ziba tezimala n'opikingamu abalala banansi n'abazaalisa n'okola equality ne ba doctors nabo no mixinga then awo ne tutegeera nti muli mu process kuyamba abasawo bano abali eyebweru. So ebyo bye tubadde tuwogerako era tusaba government ekole n'amaanyi nnyo kubanga next week tetwagala bazadde baffe kusigala nga balina balumirwa nga tulaba abaana batambula bagenda ku parliament bagende neno bakola demonstration ebyo si bye twagaliza eggwanga. Abantu bano basasudde fees ate n'amateeka gakkiriza nti no bw'oba omaze okukola okusoma osobola okukola internship eno kimanyiddwa era kyovola neno budget mwagikola. So tusaba tetwagala kuwulira ate eggwanga lyaffe nga mulitadde kuki ku bunkenge era abasawo abali eyo ndowooza mukimanyi nti tukola ne solidarity. Singa ate bakozeeko ku bano naffe ffennyini tujja kujja tubayambeko okudemonstratinga. Ali mu kwekalakaasa abenkana enamba 1000 olwasigadde ebweru balina ensonga nga 2 zokka. Bamaze okusoma ne bamala okusoma abamu ne balinda kumala emyaka 4. So kati bano bwe bayise nti no bagende basasule ne basasula esente za temporary licenses ekyo ekipapula kikukkiriza okukola internship. Kati ne bamala ne balonda muko basasudde emitwalo 5 fe abanasi n'abazaalisa mu Nurses Council. Ate zino ze expiringa mu mwaka ogugumu. So kati tulabanga bwe babanga tebawadde chance eno license egenda ku expiringa egenda kubanga eggwaawo mu mwaka gumu. Twagala explanation bwe ziba ziwaddewo nga tebabatutte bajja kuddamu basasule. Kati kyovola bakiina omugaso gw'amaanyi nti gavumenti econsideringa bonna bano bagwewo kubanga already nawo ne bano batidde kubanga bano abo batutte 2023 abamu babadde abemabega nga babaddewo for 4 years. Kirowoozeeko ng'omusawo omaze okukola okusoma emyaka 4 wamala 2020 2021 2022 oliawo otudde olinze nti no bakukkiriza okole ki okole internship olyoka ofulume. So bino bye bintu ebitubuzaabuza kubanga abasawo abamu bavuddemu n'ebyobusawo. Mu myaka 3 tulina abanasi bangi no n'abazaalisa babadde bajja wano nga bagamba katubivembo baba tebasobola kukola ki kutuwa license. Ate ng'obusawo twetaaga abasawo bangi wano mu Uganda.
Budget bulijjo gavumenti ekola supplementary budget ku bintu bingi. Kati eno yensonga yennyini weeyina okukola ennyongeza kuseereza ki z'okutwala abasawo okwegezaamu basobole okufuluma nga batikkirwa. Supplementary tebayite ennyongereza tugyetaaga. Finance etulene health bakiise ekyo kive mu ddiiro. Gye bujjako bwalanga balaba nti enkola eno tebajjagadde balireeta etteeka ne litambula mu mitendera gyalyo naye naffe wano union nga twebuuzibbwako nti mulowooza internship funding eveewo naffe ne tuteekamu okuteekamu ku lw'abantu baffe be tutwala kuba ffe tukiikirira basawo bangi. 75% ey'abasawo abali mu malwaliro banansi na ba midwives. So bebaba nga si basanyufu naffe tusobola kubanga tudda wano butuuzi nga tutunulira embeera etali nnungi.
Shamvaya.